If you're over the age of 65, can your spouse add you to their health insurance coverage through work and that be considered creditable coverage? And the answer to that question is it depends. It depends on the coverage through work. What is that coverage? How is it designed? Is it what is considered creditable coverage? And it's an important question to answer. There may be reasons that you want to sign up for that coverage and delay going on Medicare. I have a client that has lost a job and they want to get another job. There'll be a gap period while they're looking, and they don't want to sign up for Medicare until they retire for good after whatever next job that they get. And so in this gap period, they're looking at going on their spouse's plan or COBRA, or what are the best options? Well, COBRA is not creditable coverage, but the spouse's plan could be creditable coverage if it's designed in the right manner. There's more than 20 employees. The coverage is equivalent to Medicare. It's very important before making a decision that the spouse reach out to HR and confirm, is this creditable coverage? And is the drug coverage creditable coverage? And then get that in writing so that you have it for down the road when you apply for Medicare eventually, so that you can show that you had creditable coverage all along the way. That there's not been any gaps of time period where you didn't have any coverage or didn't have creditable coverage. Because the penalty for not having creditable coverage when you're over the age of 65 is pretty steep. It's 10% on the Part B premium for each 12 months that you didn't have creditable coverage. Now, Part B covers doctor's visits and outpatient and, medical supplies and things like that. The penalty for drug coverage is 1% a month, so that's 12% a year. And drugs plans have had a lot of changes. They're a lot more expensive, and you don't want to have these penalties because they never go away. If you end up with a penalty for Part B and a penalty for Part D, that is a penalty for the rest of your life. So as your premium goes up, then that penalty is also a bigger number because it's just 1% of whatever the premium is. So you want to make sure that you avoid having any penalty on your Medicare premiums. Make sure you have creditable coverage at all times, or just go on Medicare if you can't find creditable coverage as an option.